We are much interested in how we can design novel biomaterials function based on deep and extensive knowledge of supramolecular science. The representative supramolecular structure we focus is polyrotaxane. The polyrotaxane has a supramolecular structure, and many cyclic compounds are threaded onto a linear polymeric chain. So you will find it interesting that the many cyclic compounds are freely mobile and they are not covalently bound but mechanically locking. Nowadays, when getting benefits from supramolecular chemistry, we can make a variety of polyrotaxanes, and a typical example is consisting of alpha-cyclodextrin and polyethylene glycol. In the last decade, we clarified that this polyrotaxane mobility dominates adhering cell fate. If we prepare substrate from this polyrotaxane, we can modulate the lineage of stem cell differentiation, for example. Another fascinating function using polyrotaxane is a rapid dissociation. If any of the terminals degrade in extracellular or intracellular environments, all the cyclic compounds are threaded from the chain. Eventually, the polyrotaxane will be disappeared from our living body. From this point of view, we expect to utilize this polyrotaxane as crosslinks in order to design rapidly dissociative and eliminative materials via external stimuli. In our recent study, this idea brings us new innovation to realize reversible thickness of dental resin for patients smiling.
The adhesion of restorative dental materials on tooth surface is one of the essential techniques in current dental treatments. And the development of adhesive resin cement achieves the strong adhesion of various materials, including metals, ceramics, and polymer resin onto surfaces. These dental materials are sometimes adhered onto surface temporarily, such as orthodontic brackets. And these adhered materials are removed from tooth surfaces by mechanical detachment or destruction of the materials after the treatment. Unfortunately, such a mechanical removal of the adhered materials potentially causes damage and fracture onto surfaces. So, we have developed the new materials toward facilitating the debonding of adhered materials by a simple and non-invasive way. Herein, we developed photodegradable polyrotaxane by introducing nitrobenzyl groups in the center of polymer axis. This bond is rapidly cleaved by UV radiation to cause the polyrotaxane dissociation. In order to prepare detachable resin cements, we use this photodegradable polyrotaxane as a cross-linkers of currently used dental adhesive cements. We consider that photodegradable polyrotaxane is variable for drastic and rapid change in the adhesive force by UV-induced degradation of polyrotaxane. We demonstrated the beauty of this technology by bonding two plastic pieces using resin cements containing photodegradable or non-degradable polyrotaxane. Then we tested the adhesive force between two plastic pieces by tensile strength test. Without UV radiation, there is no difference in the tensile bond strength between photodegradable and non-degradable polyrotaxanes. However, after 2 minutes of UV radiation, the tensile bond strength of the resin cement containing photodegradable polyrotaxane drastically decreased. This result confirms that the polyrotaxane dissociation leads to decreasing the adhesive force.
Now, you can understand our conclusion that the resin cement containing photodegradable polyrotaxane is a promising candidate to facilitate the bonding of adhered dental materials by UV irradiation. We hope that this material will contribute to the development of new treatment in current dentistry.